Hello, I'm Ellen Horan, President and CEO of the Greater Reading Chamber of Commerce and Industry, and I'm here today with Lucille Gough, who is President and CEO of Home Healthcare Management. So Lucille, probably most people are a little more familiar with the Berks Visiting Nurses,
Yes.
but absolutely related and in fact affiliated. So why don't you give us a feel for what Home Healthcare Management is?
Okay, Home Healthcare Management was actually created in 1987. It's what people call a parent company, and it houses all the types of services that we can share among our subsidiaries, such as management services, human resources, payroll, billing, education, orientation of new staff, performance improvement, our volunteers. And it does that for our three subsidiary companies, Berks Visiting Nurse Association, which has been in the community since 1909, so most people know it.
Still call it that.
Yes, and Advantage Home Care, which is a company we created in 1987 when we created the parent company. And that houses our non-skilled type of services, personal care, homemaking type services. And then the Visiting Nurse Association of Pottstown and vicinity became part of our family in 1998.
Okay, good. And the range of services that these organizations provide, do you get involved in that, or you're just more or less the backbone organization? Do you do the hiring and
no,
the
we
management
do the
of the staff?
hiring for the management, and we oversee management of all the companies, and we do the hiring is all done through the parent company. But then the people are employed by each individual company that they're employed for.
So you don't deploy them per se.
No.
Got it. Now I assume you came up through the healthcare ranks yourself. How did you come to be president of the organization?
I always say I was at the right time at the right place.
Yeah.
But I started as a staff nurse. I'm a registered nurse, originally a Reading Hospital graduate. And I started with the agency in 1971 as a staff nurse, and was very fortunate that the board of directors at that time was very forward-thinking, and my predecessor was also very forward-thinking and knew that they wanted people with advanced degrees. And so with their assistance, I completed my bachelor's at Albright College, and then I did a master's in nursing with a minor in administration at the University of Pennsylvania, and then I did my MBA through St. Joseph's University. So
a true continuous learner.
Yes.
Congratulations.
Yes.
And you actually have a big milestone coming up. You want to share that?
Yes, I will be retiring after 44 years with the organization.
Well deserved. Thanks for all that you've done for Berks County and for the organizations.
Well, thanks. It's been great. It's just been a pleasure being able to work with the agency, see it grow to where it is now, and know that it's here for the future for all of us.
Now, how many employees are the three organizations up to?
Well, among our organizations, including Pottstown, we have over 400 employees.
Okay. Definitely a growing field.
Yes.
What are some of the trends in home health care?
Well, I think what we're finding is that those of us who are baby boomers and are going to be aging and want to age in place. And so people want to stay at home and they want to be cared for their needs at home. And I think what you're going to see is more and more people who will pay personally for services such as assistance with bathing, dressing, maybe making meals, light housekeeping, to help them stay in their own homes. And then if they become ill, and they maybe are in the hospital for a short period of time, they want to go home again. And so they'll go home with skilled services like ours through the Visiting Nurse Association. Because I always say we can provide all the services you need except we're not an emergency service. So for instance, we have our registered nurses, we have physical therapists, speech therapists, occupational therapists, medical social workers. We have home care aides. And then when people are facing the end of life, we have our hospice program. So people can really age in place in their homes with services like ours.
Right.
And then if they are not able to stay in their own home, we just, it's almost 2 years ago now, we've added a service through Advantage Home Care called our Advantage Care Cottages, where 3 people can choose to age in place with a caregiver that we provide in that home 24/7.
Wow.
So,
Didn't know
while
that
it's
one.
not their own house, but it's their home because they're living there.
Right. Now, you also do some services for employers, such as blood pressure checking and the immunizations I know you've done. I didn't know you did a speakers bureau as well. So an employer can avail themselves of that by...
Yes, all they need to do is call our agency and ask to speak with our coordinator for that service. It's her name is Colleen Palucci. She's our manager for those services. And as you said, we do immunizations. So we will do a flu program on site for employers, which some employers really like because their employees don't have to leave their facility.
Right.
We can do it there. We also, on the immunization side, do travel medicine, which a lot of people don't realize. But we, for instance, if you're traveling somewhere, you can contact us. We have the software program to determine what immunizations are recommended. You tell us if you want them. We tell you what the price is, and then we would order them and provide them for you. In addition to that, we do have several programs where we will go in and do like health clinics for people. Maybe the employer wants blood pressure checks, as you said, or just wants a nurse on site weekly for maybe a couple hours so their employees can avail themselves of a nurse if they need it. So we will do those things as well.
Yeah, a lot of employers, as part of their enrollment process, will do a health fair. So good to know that the... now, would they call the Berks Visiting Nurses, or would they call Home Healthcare Management?
It'll be done under Berks Visiting Nurse Association, but it's arranged really under our parent company. But it would be done under Berks Visiting Nurse Association because that's what most people are familiar with.
Yeah, very good. Is there anything else you would like your fellow chamber members to be aware of?
I think just to say that out there are many other home health agencies, and hopefully they will remember to ask for us by name because we have been in the community for many years. We are a CHAP accredited agency, which is higher than Medicare standards. It's a community health accreditation program. It's a vigorous program that you go through to be accredited. And we provide what I believe is the best quality of home health care in our community.
Very good. Well, thank you for all that you do for the community, and enjoy your retirement.
Thank you.
Thanks so much for being a member of the chamber, and hopefully you'll stay active through Women to Women.
Hopefully so. I'm thinking about what I will do in my retirement, but I'm sure volunteer work will be part of it, and just being active in different organizations.
Excellent. Thank you for being here.
Thank you.